There are signs that indicate blood sugar is unstable, and often they go unnoticed. Recognizing these signals can mean the difference between detecting a problem early or only discovering it when serious complications have already developed. What few people realize is that up to half of adults live with altered blood sugar, prediabetes, or diabetes without knowing it. Meanwhile, organs such as the eyes, brain, kidneys, heart, and arteries are being silently damaged, and that is why so many people find out too late. One of the first signs is excessive thirst. Sugar circulates in the blood in the form of glucose, which is the body's main source of energy. Under normal conditions, the kidneys are able to filter this glucose and prevent it from being lost in the urine. But when levels are very high, this mechanism does not work as it should. Glucose begins to escape into the urine, and since glucose molecules attract water, they draw out a large amount of fluids as well. The result is a cycle that seems endless. The more water a person drinks, the more water they lose, and therefore they remain dehydrated. This process leads to a second very common sign: the need to urinate all the time. People with uncontrolled blood sugar often go to the bathroom many times during the day and also at night, interrupting their rest. In many urine tests, what appears is called glycosuria, the presence of glucose being eliminated. This is a clear sign that the body is trying to get rid of the excess sugar, but at the same time it is losing precious fluids essential for balance. The dehydration caused by this constant loss brings other consequences. The blood becomes thicker, circulates with more difficulty, and overloads the entire body. The brain receives this signal and triggers an even stronger sensation of thirst, as if it were never enough. The person drinks water constantly, but remains tired, because every time glucose is expelled through the urine, the body also loses electrolytes and energy. This is the beginning of a vicious cycle: excessive thirst, frequent trips to the bathroom, loss of energy, and continuous dehydration. And while many believe these signs are normal or temporary, in reality they are important warnings that the body is no longer able to properly manage blood sugar levels. Another very frequent sign of high and unstable blood sugar is constant hunger. Many people report that they eat a lot but never feel satisfied, and just minutes later they are already looking for more food. This happens because the body's natural satiety mechanisms become compromised. The body produces hormones that should send the brain the message that enough food has been consumed, but when there is inflammation and insulin resistance, this system fails. One of these hormones is leptin, responsible for signaling that the body has already received sufficient energy. When chronic inflammation is present, the brain does not correctly interpret this signal. As a result, even after a full meal, the person continues to feel hungry. This creates a dangerous cycle. The more one eats, the higher the blood sugar rises. In response, the body releases insulin to control the spike. Shortly afterward, blood sugar drops quickly, and the body interprets this drop as new hunger. This continuous rise and fall, these spikes and dips in glucose, create what we call blood sugar instability. The result is a permanent sensation of hunger, food compulsion, and often irritability. It is common to hear people say they feel fine one moment, but suddenly become anxious, impatient, or even aggressive without understanding why. In many cases, it is not about personality or temperament, but rather unstable glucose levels. In the long term, this constant dysregulation leads to the accumulation of fat, especially in the abdominal region. This fat is not just an aesthetic issue. It is called visceral fat, which surrounds the internal organs. It releases inflammatory substances that worsen insulin sensitivity even more, increase hunger, reduce satiety, and perpetuate the cycle of weight gain. People with a prominent belly usually face exactly this problem. They feel hungrier, crave sweets and carbohydrates, and find it very difficult to lose weight. This inflammation is not limited to weight. It affects the entire body, increasing the risk of cardiovascular diseases, kidney problems, chronic fatigue, and emotional disturbances. The body stops properly using the energy available because glucose is not efficiently directed to the muscles and tissues. For this reason, even after eating a lot, the person feels they do not have enough energy for daily tasks. This state of constant hunger, combined with irritability and the accumulation of abdominal fat, is a clear warning that the body is trapped in a cycle of blood sugar instability. Recognizing this pattern early is essential to interrupt the process and prevent it from progressing into even more serious complications. Unstable blood sugar does not only affect hunger and mood, It also deeply compromises the body's energy. Many people report feeling tired all the time, even after a full night's sleep. It is as if they had done intense physical exercise, even on days when they did not perform any activity. This constant fatigue is a direct result of glucose fluctuations. When blood sugar rises and falls quickly, the body cannot use that energy efficiently. Glucose should be fueling the cells, especially the muscles and the brain, but instead it remains circulating in the blood or is lost through urine. This means that even with high blood sugar levels, the cells remain starving, not receiving the fuel they need. The result is weakness, daytime sleepiness, and lack of energy for simple tasks. This scenario worsens at night. Excess glucose increases the need to urinate, making the person get up several times, interrupting deep sleep. In addition, dehydration caused by fluid loss leaves the body more restless and the brain more overloaded. The result is a poor night's sleep, which translates into even more fatigue the following day. This pattern of fragmented sleep and low energy creates a vicious cycle. The less rest one gets, the higher the stress levels rise, and the higher the stress, the more blood sugar goes up. At this point, lab tests already begin to show clear warning signs. The most common test is fasting glucose. Values below 100 are usually considered normal. When they appear between 100 and 125, they generally indicate prediabetes, and above 126, in two separate measurements, they confirm the presence of diabetes. Often, however, a single measurement does not tell the full story. It is necessary to observe the context, repeat the test at different times, and understand that infections, medications, or even preparation before the blood draw can influence the result. That is why it is crucial not to ignore small deviations in test results. When the numbers start to rise, even slightly, it is already a sign that the body is losing its ability to control blood sugar. Waiting for the values to become very high before taking action is a mistake that can be costly. The body sends signals even before a formal diagnosis, and it is up to each person to pay attention to these warnings. Chronic fatigue, difficulty concentrating, poor sleep, and lab results that start to shift are all pieces of the same puzzle. Together, they show that something is not working properly. Recognizing these signs is the key to stopping the problem from advancing and regaining energy before more serious complications appear. In addition to fasting glucose, there is a fundamental test to assess blood sugar control: glycated hemoglobin, also called HbA1c. Unlike regular glucose testing, which shows only the result of a specific moment, this test reveals the average blood glucose levels over the last 3 months. This prevents small lifestyle changes just before the test from hiding the true state of the body. Many people, for example, try to take care of themselves only in the week before the test, cutting back on sugar and making healthier choices. As a result, fasting glucose may appear acceptable. But HbA1c reveals the reality because it shows how glucose behaved during the entire period, not just on one day. Elevated values in this test confirm that blood sugar has been out of control for a long time, significantly increasing the risk of complications. These complications are not abstract. They are real and affect the lives of millions of people. Diabetes is now one of the leading causes of blindness worldwide. Excess glucose destroys the delicate blood vessels in the retina, causing irreversible damage to vision. In the kidneys, constant overload leads to kidney failure, where the organs can no longer properly filter the blood, forcing patients to rely on dialysis. In the cardiovascular system, the impact is devastating. High blood sugar promotes the buildup of fat and inflammation in the arteries, increasing the chances of blockages. These blockages can result in heart attacks, strokes, and even sudden death. In addition, the extremities of the body also suffer. Wounds on the feet and legs take longer to heal because circulation is compromised and immunity is weakened. Many times, these wounds develop into serious infections that can reach the bone and even require amputation. It is important to understand that these consequences do not appear overnight. They are the result of years of unstable blood sugar and neglecting early warning signs. Small symptoms like constant thirst, excessive hunger, irritability, or fatigue, when ignored, can evolve into irreversible damage. Every altered test result is a warning that the body urgently needs change. That is why HbA1c is so important. It shows the full picture, revealing the truth that fasting glucose alone often cannot show. And understanding the seriousness of these complications is the first step toward acting preventively, before it is too late. Faced with so many risks, the big question arises: what can be done to prevent or control high blood sugar? The answer is not found only in medication, but mainly in habits that strengthen the body and restore balance. The first pillar is prioritizing health. Many people believe they do not have time to take care of themselves, but they forget that without health, all other projects and responsibilities lose their importance. Making health a priority means setting aside moments to eat well, rest, and practice physical activity, even in the midst of a busy routine. The second pillar is movement. Physical exercise is one of the most powerful ways to control glucose. When muscles are activated, they open the way for glucose to enter, using it as fuel and helping to lower blood sugar levels. Age does not matter. It is always possible to find an appropriate activity. Walking, cycling, swimming, dancing, or strength training. All of them contribute. Even small daily changes, like taking the stairs instead of the elevator or parking farther away, already make a difference. The third pillar is nutrition. Replacing inflammatory foods with natural options transforms results over time. This means swapping sodas, artificial juices, and sweets for water, unsweetened coffee, green tea, or water flavored with lemon and cinnamon. It is also important to include healthy fats, such as olive oil and fish, as well as quality proteins to preserve muscle. Natural seasonings like turmeric and apple cider vinegar help reduce sugar absorption and fight inflammation. The simpler and more natural the food, the better for the body. The fourth pillar is hydration. Drinking enough water throughout the day helps the kidneys work better, dilutes excess glucose, and keeps the body in balance. A good guideline is to consume about 30 milliliters per kilogram of body weight daily. This simple habit prevents dehydration and improves the functioning of the entire body. Another essential point is sleep. Poor sleep increases stress, raises the hormone cortisol, and makes blood sugar rise. Establishing a proper rest routine is just as important as eating well or exercising. The body needs nights of restorative sleep to regulate hormones and keep metabolism working properly. In some cases, the use of medication may be necessary, but it never replaces healthy habits. Taking medicine without changing diet, sleep, or physical activity is like trying to put out a fire with a glass of water. True transformation comes from the combination of medical care and personal discipline. The most important thing is to understand that the body always warns when something is wrong. Constant thirst, frequent trips to the bathroom, excessive hunger, irritability, fatigue, and altered test results should not be ignored. These signs are warning signals, and acting on them is the best way to prevent serious complications in the future. With simple daily choices, it is possible to keep blood sugar under control, protect the organs, and regain the energy to live longer and better. Health lies in the small actions repeated every day, and every decision counts in transforming life.